Greetings and a warm welcome to all the dignitaries present here. I'm Sriyoshi from Planet, serving as the allocated session assistant to ensure a seamless experience. Planet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Planet serves as the digital partner for this event hosted by the Indian College of Anesthesiologists, and the focus of today's session is tips and tricks for successful publications. So let's begin today's session, for which I would like to invite Dr. Manjula Sarkar ma'am to take over. Over to you, Manjula ma'am.
Thank you, Sreshi, for kind introduction of mine to the audience. And on behalf of Indian College of Anesthesia, I welcome you all. Dais on the dignitaries on the dais, Dr. Professor Rakesh Garg, Dr. Murlidhar Kanchi sir, Dean of our college, Jai Shri Sood Madam, Trustee of our Indian College of Anesthesia. And the topic for today is on writing and publishing the articles. As all of us knows that writing and publishing is an art and craft of medical writing, and if you know that how to do the best for that particular medical literature, then you are going to do the good work and your papers are going to get published sooner. Dr. Professor Rakesh Garg doesn't need any introduction, but still I have to introduce him. He is a professor at AIMS Delhi, and he is a chief editor of our Indian Journal of Anesthesia. There are many things on his credit. His area of interest is onco anesthesia, writing, publishing, doing the many workshops on writing and publishing the articles, many books, many book chapters, many journals, many reviewers of the many journals. So what is not in his credit, I'm really surprised, and how he's managing so much on this field. So over to you, Rakesh Garg, for today's topic, scientific writing tips and tricks. I welcome you once again.
Thank you so much for the kind introduction, and thank you for all your blessings always, man. Learned a lot from you all, my mentors and teachers, and the leadership of ICA, Sood Madam, and all the leaders, Dr. Murli, everybody who has contributed a lot towards the academic teaching and training. So moving towards the topic of scientific writing, the tips and tricks. Each one of us do want some publications, and today is the AIMS Research Day going on, and a lot of research publications and research arena is being conducted at this from today till this weekend, and a lot of research activities are being planned at annual AIMS Research Day, where we have learned a lot and owe a lot to the institute, where it has given a robust platform for us to understand the leading institute excelling in research contribution to the community. Now, when we say why publications, each one of us may have different reasons for publication, though the prime reason is dissemination of the information to the whole community so that they can advantage of the recent updates and they can provide the care to the patient in the updated manner. But simultaneously, it also gives you a better understanding. It makes you discuss the issues and get the solution and improve the patient care. But definitely, it also gives a lot of recognition. So when you say somebody has an H index of 30, 40, 50, and if they stands in top 2% of the researchers in Stanford University ranking, definitely it gains recognition also and gives laurel to your work. So the reasons could be many, whatever it is, but let's see why we look for. Now, this is an important slide. Why do we want to do research? When we say evidence-based medicine, you must have seen this triad of or the three pillars of the evidence-based medicine. When you look for the best evidence, we also need to look for the patient values and expectations and the clinical expertise. And hence, this slide, when we say evidence-based practice or evidence-based medicine, is important for to understand that why Western literature or Western research may not be applicable to our own population and even in India, different locations. Hence, it is important to understand that the clinical expertise, the patient values, the expectations, the geographic difference, the demographic differences will vary, though the evidence of a particular drug or a technique or a strategy may remain same, but the other two pillars of evidence-based medicines may differ. And hence, we need to have our own publications from our own country, from our own people, patient population, so that we can practice evidence-based medicine more effectively and more practically. And that's the reason that we always encourage each one of you that whatever the enormous amount of clinical work each one of you are doing is important for you to publish them also, so that it helps the whole community and they can practice much better. Now, having said that, what are those publications? Yes, when we say research publication, it is usually an original article, but definitely there will be other forms of publications, which will be review articles, which can be narrative reviews, systematic reviews, and meta-analysis. And there could be case report, case series, and letters also. And some journals will publish in different format like commentaries, perspectives, opinions. So these are again individual based opinion of a particular technique or a strategy or an article, which you can say critically appraised at published literature, so that you get a feel of it from an expertise opinion, expert opinion, that what are the limitations and what are the positives of that particular paper and how can we incorporate into our clinical practice. Now, when we say how to write a scientific manuscript, it's a simple process. It's although not very difficult, but we need to understand it. Once we understand, it becomes very easy for having a successful publication, but we have to follow the step. If you miss any of the steps, if you don't fulfill them appropriately, probably the success may not be there. And hence, follow the right road so that you get it published. Now, during the published process, let's see what the research process is. Research process starts with your research question or the clinical problem that you have. You review the available literature, formulate a question, and then subsequently select an appropriate research design. And then you try to conduct the study, collect the data, analyze them, interpret them, discussion, and publish. And this published material becomes review of literature for subsequent researchers for their future studies. So this is how we continue the publications, and that's why the cycle of publications continue, because each research will have some outcome remarks, but they may also have some limitations, and those limitations becomes the idea for the next publications via a research. So when you're looking for a research idea, it's always to look for a published paper, a recent one, and look at what are limitations. Majority of them, if you see the last paragraph of discussion, the authors will emphasize the limitation of the study. And those limitations can be food for thought for you to plan future studies. And that is how we talk about the novelty when we conduct those studies. Now, since today's topic is the tips and tricks for a successful publication. So whenever a researcher, an author, submitted the article of her done research to a journal, what exactly the reviewers or the editors are looking for? Majority of time, there are two important aspects. One is the originality or novelty. This is I have just emphasized for you. That's something which has not been done or not very clear or not very conclusive amounts to the novelty or the originality. And then it should have to have robust methodology. Now, sometimes we may not have well-written things, that's acceptable. But if the components of the study, along with novelty, the ingredients of the methods, which I'm going to discuss in next around half an hour or so, will amount to the success of your publication. And that ingredients are important. And that should be part of your protocol even before starting the study, because once you have completed the study, if something is missing, you cannot change the methodology now. So it becomes important that for a successful publication, all the ingredients which are important All the components of for your future published paper must be a part of your protocol also. If you just remind them during the protocol that these are all points, and if you follow them up, probably you will not find anything missing when you submit it for publication. So this is an important aspect that you need to remember. So the originality, the importance of new information, the sound scientific quality and methodology, and then comes the importance of scientific field and clinical importance, and then comes the clinic clearly written that can always be improved, and obviously it should adhere to the journal scopes and the instructions. All papers that you send for publication usually has 4 main components: introduction, methods, results, and discussion. Now, why this slide is there? Because sometimes we try to mix up some of the components under different headings. Say, for example, methods, how the things has been done into the research. Sometimes they can come, sometimes authors may write in results. Sometimes results comes into discussion. Sometimes methods comes into introduction. So you need to remember that introduction is why did you start? Methods is what did you do in detail. Results are what did you find. Here no method, no interpretation. And discussion, what does it all means? That is the discussion, interpretation. So be very clear that all the headings should have concerned components and they should not be mixed or repeated in other headings. Now, these are the common reasons why the manuscript appears to be not well written. If you see all the red ones, these are important so that when you submit your paper, be careful about that. Poorly written, excessive jargons, inadequate or inappropriate presentation of tables, graphs, paragraphs, which I just mentioned, poor discussion of the study design methodology, and then small things when the interpretation or expression of data is not well. So these are common things which sometimes in the published paper, the reviewers or the editors find they becomes a reason for rejection and should be taken care of. The most common, if we take out the novelty part, the method section has the most common section which has been found to have major flaws, and that's the reason they have been a reason for rejection. But if method section has a flaw, then probably the results will not be appropriate. They will not be appropriately interpreted because something is lacking in the method section. Hence, you should be very clear that what has been written into the method section should be very clear, unambiguous, clear, transparent, and all details are available. And then only your other section, especially the result discussion, becomes useful. The manuscript, if you see the manuscript published around 10, 15, 20 years back, they used to have a very detailed discussion section. But if you see the publications in the last couple of years, now the discussion section is very brief because everybody has an access to the published literature earlier. So no need to repeat those published literature again. But what you need to have a very detailed method section. If you see this graph, you can see the light blue color is the original and the orange color is the final revised version. You can see that editors and viewers are asking more details in the method section and less details in the discussion section. And this is exactly we want. Your method section should be in detail, discussion should be in brief, and you always cite a reference. If somebody wants to read it, they can read it again. And this I repeat once again, planning of publication is not after the completion of research, but it should be at the planning stage of a research itself, because you have to include all the ingredients, all the components at this stage itself, so that you are not missing something. And accordingly, you should introduce all the sections as per under IMRAD pattern, that is introduction, methods, results, and discussion. And then you can add other sections which are acknowledgement, references, tables, figures, appendices, and abstract also. Now let's go by one. So what all things you need to remember so that your paper becomes the best paper. Coming to the title. Now this is like an advertisement. If you write the title very well, it will be taken as an acceptable one. If somebody reads title can understand the novelty, the importance, it will be considered that it appears to be a book paper. And this is usually seen by when you submit the research, when a reader want to read it, reviewers wants to read it, editors wants to read it, they will see the title first. So your title should be short, specific, relevant, and descriptive. It's usually around 12 to 15 words. The key here is try to include the key points or the key points from your research question or the primary outcome or the primary research question. Those keywords must be part of your title because the whole manuscript is based on your research question, primary research question. And that's why the title should reflect the primary research question in short, specific, relevant, and descriptive way so that it is inclusive of the so-called picot of the research question. If it is there, it becomes better, right? Now, when you write a title, just think, if you need to emphasize to somebody in a single sentence, what is that best sentence? So start working on it. And you can ask your colleague and say title. If they can understand the novelty, the importance, the originality, and what you have done, this means it is absolutely fine. And this is what you can do. Try to avoid abbreviations, qualifiers, jargons, A and the or studies on. So try to avoid these type of words into the title because they just unnecessarily increase number of words without adding anything. Sometimes your title could be in a question form or a statement. So that is up to you, but majority of time, it should reflect the research question, the primary research question into the title. Coming to the abstract. Abstract should be written at the last once you have completed everything. But remember that abstract usually will be seen first by the editors and reviewers before they send it for review process or for considering paper. So this is again become a base for assessing the novelty and for the originality of the study, for the component of the study, for the method section, for whether your study design is appropriate or not. So all those will come from the abstract. So write it appropriately. You should not take it lightly, and it should be written at the last once your manuscript is over. It's usually appears as the first section, but should be written last. Should contain well-articulated objective and hypothesis. It's usually written in past tense, and it does not have any references. And it should absolutely corroborate what you have written in your main manuscript. There should not be any additional data or any additional missing primary data. So be cautious that it should reflect the brief summary of your method, of your results, and the primary research question of the main manuscript into the abstract. Usually 4 headings: background aims, methods, results, conclusion, keywords. Doesn't have a discussion section, and it should have keywords, which should be ideally the mesh keywords. Summarize the paper. Don't just cut and paste. Don't say that 2 lines pick up from introduction, you paste in abstract as the background, 3 lines from the method section, paste into the method of the abstract. So this needs to be avoided. You should try to read the sentence and try to summarize in brief. Some journals are around 250 words, some journals are 300 words. So as per the words requirement, you can always try to use full number of words allowed so that it becomes descriptive. Now, common mistakes that we see is too much background, no aims, no objectives, no hypothesis, presence of figures not allowed, references to other literature should not be done, and a lot of abbreviations and acronyms. Usually in journal language in the operating rooms or perioperative care, we are in habit of speaking very short terms, like for example, peri-op period, post-op period. Now, these are slangs that we use, and these are not scientific writings. It's not peri-op period. It should be peri-operative period. It's not pre-op period. It's pre-operative period. So, ICU and all those things may be standardized, but then again, they need to be expanded at first mention. So please be careful about those short terms which are not standardized. Try to avoid them into the scientific writing, and that's important. Just few tips: write it at the last, keep to required length, focus on results, include a take-home message in conclusion. Do not mention references, no figures, and the information that is not in the paper should not be part of your abstracts, right? So this is important. Now, the keywords, you can always go through the PubMed. It has a mesh. It's called mesh keywords. You can always paste paste your the manuscript here. They will give you some of the relevant mesh keywords, medical subject heading keywords, and those mesh keywords should be cited as keywords into your abstract. Now coming to the introduction section. Now introduction should be brief. You should not be writing words and words. It's not the review of literature as we do in thesis and dissertations. It should be very brief, just to the point that you start with the known and you move to the unknown. That is what you are supposed to do. That's it. So no more details. You can mention 4 to 6 references and keep it to the focused one, adding on to the primary research question, the objectives, and the hypothesis. That is what is required introduction, so that it becomes very, very focused one. It is also important that the number of references should be the latest one. If you are mentioning, say, 20, 30, 40 references, that will itself indicate there is no novelty into the paper, because already 40, 50 papers are there in this area. So once you have 40, 50 papers, this means novelty is already not there, and that's why you can expect a rejection from a good journal. And under this heading, then you can write your introduction section. When we say the research question or the hypothesis also, you also need to follow them certain requirement, and it is usually called as finals and picots. The research question, when you plan your protocol, should fit into final. It should be feasible, interesting, novel, ethical, and relevant. And when you say picot, when you write a research question, or maybe you can translate into title also, it should have these components. Is important. Your research question, your objective, your outcome, your hypothesis, primarily should have these components: study population, intervention, whatever it is, drug, strategies, intervention blocks, whatever it is, control arm, if it is an RCT, outcome measures that you are measuring to look for the effect of intervention, and timing. At what point of time are you measuring your outcomes? So this must be part of your research question and the objectives that you're mentioning. The reference cited here should be latest one. They should be related to your primary research question, and they should corroborate with the main finding. And just don't try to put references which are not at all related to your primary research question. So for introduction, use the present tense when referring to the work that has already been published, but past tense when referring to your own study. Active voices as much as possible. Avoid lengthy or unfocused reviews. Cite peer-reviewed scientific literature. Do not put literature from Google, but look for the search engines like PubMed, Scopus, Cochrane, Medline, something like this, and define any specialized term or abbreviations. All abbreviations should be expanded at first mention. Usually what we see in the introduction section, too much or not enough information, unclear purpose, a lot of listing there, confusing structure, first person anecdotes, they are not required. So be careful about these aspects. So this is what to summarize, what should be there into your introduction. What is known and unknown globally, the elements that make this issue important, the regional perspective on this issue, the local presentation of this issue, objectives, research question, and hypothesis. This is what is required into the introduction section. Coming to the next section of your publication, materials and methods. Now this, though it is rarely read by the readers, but this is the most common section which is very nicely scrutinized by the reviewers and editors. Because anything missing here will create a lot of biases in your results interpretation. And that's why your method section should be very detailed, transparent. It's something like telling a story actually. So each component of story must be elaborated in detail here without thinking that you are putting extra words. Anything deficiency or inadequacy will be easily looked by the reviewers and editors, and they will ask for you to fulfill it. And if you have not planned during the protocol, it becomes a reason for the inappropriateness. And they will think, is the study valid? Is the study replicable? So when you write method, Just read it once and ask somebody to read it. If they say they can exactly do the study in the similar way, this means you have included the details. For example, if you mention the BP measurement, you should mention BP by what route. It is non-invasive or invasive. In what position? Sitting, supine, semi-sitting. Which reading? Lowest reading, best reading, one reading, three reading, average of three reading, mean of three reading, what? So all those things should be mentioned very clearly into the method section so that person who wants to do the study again understands exactly the same way that you have done. So this replication is important. And then others can evaluate what you did. And that makes your results and conclusion valid. If they cannot understand how you have done, the results probably will remain not valid from them and not acceptable for them. So to replicate this, these components must be their method section. Ethical approval. Nowadays, it's also important for trial registration on various portals like CTRI, Clinical Trials. Describe your study design, inclusion and exclusion criteria, sample size, sampling techniques, randomization and allocation concealment, blinding, study setting, intervention with all details, whatever intervention. If it's for example, regional block, mention what probe, which frequency, what ultrasound, which patient position, which area to be scanned, and what should be the direction of needle, which length of needle, which make of needle, which drug, how much concentration, how much volume, all things should be there. You should also describe data collection protocols, tools, and equipments. If you are using ultrasound machine, mention which ultrasound machine are you using. If you're using needles, which needle are you using? If you're using monitor, which company, which make you are using? Because each will have some difference. That's why these details are required. And then mention the details of the data analysis. Which software you have used, how you have compared, which test you have applied, what was your sample size, which software you used, which was the study based on which sample size well calculation, what was alpha, what was power, what was the previous studies values that we have incorporated into sample size, how you have incorporated and adjusted for log to follow. All those details must be there. And that's why if you remember the initial slide, I mentioned that it is the most you can say the detailed version where you need to have everything there into the method section so that people can see. Similarly, describe about the sampling, the target population, from where you choose. Was it OPD? Was it OT? All patients recruited in intensive care unit? Which intensive care unit? Surgical, medical, neurosurgical, cardiology, cardiosurgical. And then try to, if it's a randomized study, how did you randomize? What randomization was done? So all those there should be there part of your techniques. Details of the techniques. If it is a well-known method, it's a published method, you can always mention the technique and cite the reference. If it is not described, mention it appropriately. If it is your own technique, you have to have a detailed description. So this is what usually we expect of your intervention. Should be written in past tense. Some journals may include subheads, some may not. Like, for example, Journal of Onco-Anesthesiology and Perioperative Medicine, Indian Journal of Anesthesia, Journal of Anesthesiology and Clinical Pharmacology. These usually does not allow the subheadings. It follows the IMRAD pattern. Some allow, you can always look in the instruction to authors and read the similar articles. Include tables and figures wherever appropriate. This is usually acceptable so that this becomes important and understandable for all the readers. For any outcome measures, endpoints, observation parameters, define them. What technique and at what timing, and whether a follow-up is there or not. All those things must be described in your method section. Data analysis, organize accordingly to the purpose of study. Provide detail or reference to technical methodology, but do not leave loopholes that people are just guessing what you have done. So mention all the details here that what has been done, and include a paragraph of statistical analysis where, as I mentioned earlier, you need to mention everything. Let's just say the analysis was done as appropriate. No, it has to be done. The statistical analysis include the SPSS version, this manufactured this. The data was analyzed for normality. These data were having normal distribution and hence were compared. These parameters were compared using this statistical test. So all those details should be there in the method section. You should understand your variables well, and accordingly you need to choose the data. You should know that your data is Gaussian distribution or not Gaussian distribution. Be careful and ask your statistic person to tell you. Based on this, use your descriptive statistics and inferential statistics. If it is a Gaussian distribution, mention your data as mean standard deviation. If it is non-Gaussian distribution, mention them as median interquartile range. In the inferential statistics, if it is Gaussian distribution, apply parametric test. If it is non-Gaussian, apply non-parametric test. So this is in front of you. This is a big class. Maybe we can have some time how to use various statistical tool and interpretation. It's a big lecture, but this is just a summary chart for you where you can have a look of various statistical tests based on Gaussian versus non-Gaussian distribution, categorical versus quantitative test. So based on this, you can choose what test is applicable for you. So we may not be going detail, but you can see in this chart clearly that parametric, there are different tests, non-parametric, there are different tests. And hence always ask your statistic person to tell you whether data is normally distributed or a Gaussian distributed or not. And based on this, just check. If it is normally distributed, 2 group sample size, it should be student t-test. But if it's not normally distributed, it's not student t-test. It will be man with t-test. So that's why the difference should be very clear when you look for. Don't do multiple analysis. If it's, you have not described a priori, remember this is a very big harm to the data. Because when we do multiple testing, if you remember, we usually assume alpha of 5% as acceptable. But if you do multiple testing, this 5% error, which was acceptable, can become 10, 20, 30, 40. If you do 16 times, 16 group analysis into a study, it will reach almost 60% error, which is not acceptable because we can only accept 5% of error in the study. If you remember, alpha is 0.05. Hence, the multiple testing should be avoided. Don't torture your data too much. So avoid all multiple testing because if you do more than test, your false positive rate will be much higher than acceptable limit of 5%. And that's why subgroup analysis and multiple testing is not encouraged routinely into a study if not taken into consideration during the sample size calculation in the beginning itself. Results, always try to summarize your study by a consort flow diagram for the randomized controlled trial. And similar flow diagram can also be used for an observational studies. Do not mix results and discussion. Results section, state the results and presenting supporting data. That's it. Do not compare or relate the findings to other works or try to interpret with reference to the other published literature. Also, remember, there is a difference between data and results. Data is facts that you have obtained, but result statements, they are statements that interpret data. For example, the first statement is purely data. This is not the right way of reporting the results. 20 control subjects, mean pain score was this. In comparison study group, pain score was this. This is just data. This is not the right way of writing results. The results would be the mean pain score was higher in the control group than in the study group, 5 versus 2, p-value 0.02. So try to understand the data and results. So when you send it for a publication, these are the results, not just the summary of data. Objective presentation of experimental results, so just try to summarize it. Don't try to interpret those aspects. And always remember that the format in which you have written your methodology, they should reflect into the results. The study flow, baseline data, primary endpoints, secondary endpoints, and the adverse reaction. So this should be the sequence you should follow. Often the results, for example, hemodynamic parameters, multiple recording, they should be better if you can put figures and tables because they can understood better. Do not try to use significant unless you mean statistically significant. Sometimes significant word is used for English meaning, but when you write paper, do not do it. Statistical significance is not equivalent to clinical significance. So interpret your data always clearly. No significant difference does not mean but both the groups are equal. So try to look for those causation, association, clinical significance when you are looking for the things. for the data that you have. P-values does not show magnitude of advantage or difference. It only says by chance. You cannot say if p-value is 0.0001, then group A is much better than group B with huge margin. No, it is just by chance. So for this, the other parameters, the mean difference, the confidence intervals, and other things that you look for, NNTs and NNH that you look for the magnitude of these aspects. Tables figures, whenever possible, try to include your table figures. They are important. It summarizes your paper very well, and they should be clearly formatted as per the requirement. Whenever you use photographs or tables from other papers, always remember to take permissions and label them appropriately. The data set should not be repeated in the text and the tables figures. For example, if you see this, so much of figures, it could be good if you can put a figure there. So for results, try to avoid raw data, redundancy, no discussion, add figures, and do not report methods and materials here. So these are common mistakes. Try to take care of. Complex study designs, this type of charts are important. I mentioned table figures are important. Do not use tables when data can be summarized within the text. Use tables when readers want exact values of the data, and this will need several sentences of the text. So this is how you can take a decision to use tables and figures. Discussion is a harder section, but the purpose is to show your outcome with the published literature, and hence try to look for. Your discussion should be in three broad, you can say, sections. First paragraph is always your findings, middle is interpretation, and last is summary along with limitations. And this is how the ideal discussion section would proceed with brief discussion. So restate the main question with answer, focus on your results. Do not introduce anything new which you have not done. You can use some heading depending upon the publisher's or the editor's requirement, and always try to support your findings with the published literature and interpret appropriately. It's always good if you can add on a brief critique of your study, that is limitations. So last but one paragraph before the discussion, since you have done the study, you are aware of the various limitations, maybe the small sample size, maybe what you have done is there was some loss to follow-up, so short follow-up or incomplete data, so whatever it is. So always try to summarize the limitation that you have observed in your study during conduct, during writing, into this section of limitations, which is just mentioned before the conclusion. You can also write future direction and implication of your research. If you want to suggest some demographic change, some larger sample size, some different type of studies, or different selection of patient population, you can always put as future direction or implications of your research also. And then conclude. Usually it may be last separate paragraph, or it will be last paragraph of discussion. And it should primarily be based on your primary research question. Do not go beyond your data. Just try to answer what you have done in the introduction as primary research question, and what you find the answer into a results will be your conclusion. Nothing less, nothing more. References, follow the instructions. Each have different style. You can use any of them. Try to cite the recent one, usually latest 2 years, but not older than 5 years. Try to follow the index journals which are available. Try to avoid the gray literature. And always try to avoid references from known peer-reviewed works, textbooks, or personal communications. Use the method as per the journal requirement. Always make a note of it, either in method section or some journals will ask separately about the approvals and registrations. So approvals will be ethical approvals, registration will be trial registration. These are nowadays mandatory for all interventional studies and hence should be done. For example, this is ethical approval. So when you report it, you should always mention the numbers and dates and the ethical approval number, which you have taken. Similarly, if you have used questionnaire, you should try to look for the permission from these, because these are usually copyrighted questionnaires. So you should take permission from their authors or the publisher before you use questionnaire. And for trial registration, you must mention. Finally, when you have prepared your manuscripts, just try to read it once and twice, ask your colleagues and other co-authors to read it. You'll find that every time you'll find some corrections, some revisions into it, some missing links. So always read it once or twice or thrice once you are satisfied. And nowadays, the grammar correction softwares are available. So grammar software corrections, the softwares are allowed for correcting the grammatical concerns into a manuscript. So you can use them for corrections also. Try to use consistent words that conveys a lot of messages in few words. Always use consistent group 1, group 2, or group A, group B, or study group. Sometimes we'll write group 1 and other places we'll write control group. We'll say bupivacaine group. So when we use these different wordings, it becomes so confusing. So be consistent, whatever you use. Provide full expression of abbreviations at the first mention. This is important. Do not use any abbreviations that are not standard. Sometimes we try to abbreviate the things which are not. In notes in journals, speaking language, we can see, I gave an example, pre-op area. So pre-op is not an abbreviation. It should be pre-operative. So don't write pre-op. So try to avoid those unconventional abbreviations. And once you have completed, you can submit it. Most of the journals nowadays accept online submissions. Go to their portal and submit it. And this is how your journey of the manuscript after submission. When you submit it, the editors will see it for the technical aspects, whether every component is there or not. If no, it will come back to you for technical corrections. Everything is fine. It will be sent to reviewers for their comments. And based on the reviewers' comments, which they will be reviewed, it may be sent back with the editors and reviewers' remarks, and then the editors may take some decision. Maybe they may send back for revision, they may accept it, they may reject it, depending upon what it is, and then you can go further and add on. So this is in brief summary when we talk about the manuscript journey. Now remember that when we talk about this aspect, try to look for the www.equatornetwork.org. Now this is an important checklist. So this checklist will be seen by the editors and reviewers also during this process, which I just mentioned. So these are checklists wherein, for example, consort is the checklist for randomized controlled trial. It has certain points. All those points must be a part of your manuscript. They should not be missing. And this will be a ready-made checklist for you also, so to see that you are not missing anything. So thank you so much. And I'm sure that this will all help you to take the manuscript for a successful publication. This site remains very important, equatornetwork.org. This will give you a very good, not only a checklist, but also it has how to prepare a protocol, what should be the template for consort chart, so you can go ahead and do it. So thank you so much. We have some time, and we may take up questions if anybody have, or if anybody has comment. Most welcome for those comments also. So thank you so much, and over to you, ma'am.
Thank you, Dr. Rakesh, for excellent presentation and giving us the guidelines regarding following the track for a better outcome in the field of publications and writing the articles. So I'm sure there might be few questions on the chat box. Shreyashi, can you share the chat box for the question? And if there is no questions on the chat box, I just want to know few things from you.
Yes, ma'am.
Is a CTRI number is must for any publication in the good journal?
Yes, ma'am. Very recently, it's not recently, for last 5 to 10 years, majority of journals has made it mandatory for any interventional human study to have trial registration.
No, up till now, we were having the idea that local ethics committee is permitting to conduct the study, then we can publish the articles, and many of our articles got published also. But recently we are finding this problem in few of articles publication that they are asking for CTRI number. Even for presentation in the conferences, they are asking for the CTRI number. So is
Yeah,
it
ma'am,
must to
this is
take the
mandatory.
number, because most of the time our students.
This is mandatory now. Even if those who are going for World Congress, they are also asking for trial registration. WHO has many portals for trial registration. CTRI is Clinical Trial Registry of India. It's an Indian registry, but there are more than 12 to 13 registries across the world. If you visit WHO portal, they mentions about it. The Equator Network that I showed you the link also mentioned. You can use any of those links, but CTRI is good. But yes, majority of journals, the top journals, index journals, are asking for it. And it's one of the requirements for indexing nowadays for the journals also.
Okay.
So there is
So
not,
then
they will think suspicious. And the reason is clear, because why this has been done, because many of the time people do research, and if they have negative results, they are not published. So when do a meta-analysis or guidelines, if the negative result studies are not published, how do we know? So if somebody has registered a protocol and not published, so there will be a suspicion that this was a negative study, and that's why it was not published. Moreover, to avoid duplication of papers. For example, when we do a study, there are some ethical things. For example, if somebody wants to do a study today, comparing bupivacaine versus ropivacaine for motor block in a epidural block. Now, if somebody is looking for a motor block, this study will be labeled as, probably I will say, unethical, because it's a textbook knowledge that ropivacaine causes less motor block.
correct.
Then why are you involving 50% of patients, because it's a randomized study, for an outcome which is already known? You are harming 50% of patients. So that's why it's become unethical. When we say novelty, try to understand those components also. Sometimes for thesis, it is acceptable for novelty aspect. For dissertation, we do accept, we pass on the thesis. But we should also need to understand that if something is already proven and you want to do it again, this means you are exposing 50% of the patients for outcome which is not acceptable, because it's already proven that this does not have any role. So CTRI ethics approval will prevent those duplication of the studies. If there are already 20 studies going around the world on same areas and they're coming up, they say that almost completed. Probably by the time when you will do your study and publish it, all those will be published 20. And then you say, when I started, it was novel, but when I'm publishing, it's already published.
Correct.
It's your responsibility to just go on a CTRI and see whether this study has been done. If 40 people have registered for it, at least 20 will publish it. So when you do it for 2 years, another 20 will come up. So your study will not be known at that point, and you'll be disheartened. Oh, we did a new study at that time. When I started, it was not published, but it's not my fault now. So these registration has multiple advantages, and that's why the Journal Medical Editors, the Association of Medical Editors, which has given a benefit actually to the authors and researchers, right? Also, it gives a confidence. If I have declared doing the protocol in a public platform that I will be doing the study, and when I submit it, if they are same matching exactly the same, there is creating a confidence that what you plan, you are publishing. So there are many reasons why this trial registration has been made mandatory. And even if you see the ICA for last 3 years, it was made mandatory because it is requirement of indexing agencies also. And similarly, I say that for the ethical approval and trial registration, there is nothing wrong by the authors. It just takes 10-15 minutes. That's it. You already have a protocol with you, which you have submitted for ethical approval. If you submit, your stature will increase. The value of your paper will increase. So don't be shy about not taking trial registration. Some people will ask, should we take for observation studies? Should we take single arm studies, ethical approval? Trial registration. I do it for all patients. If you see on the FAQ of the CTRI, mention that any human trial should be taken on trial registration. It does not take.
I'm little different. I'm having little different opinion in comparison to yours, because when we are trying to register the CTRI registration, when we want to do it, it is taking almost, sometimes one month or three months of the time. in view of that they are not answering, there some document is less or not. So it is not the question of 15 minutes. It is must, there is no doubt. And simultaneously, same kind of the study is going on all over the country, that medical students are coming up. So same kind comparison of remifentanil versus fentanyl will be for, 100 of the studies. So same kind of the study cannot be registered on the basis of CTRI. So
No,
what
that's not no, that's not an issue, ma'am. CTRI does not discriminate. That is for meta-analysis. For CTRI, whatever study, they will register it. Now, second thing I will tell you, madam. Say for last many years, maybe I say 100 or 150 CTR registration I would have taken in last couple of years, and most of them will be there to me within a week. Their office is near AIMS, and I know a couple of them. So this complaint is common that they take a lot of time. I tell you the answer which the boss of CTRI gives. He said it's not the fault of CTRI. If I ask you to give me 1 kg of apple, and if you give me 1 kg of banana, how would I feel?
Okay.
If I ask you 12 bananas, if you give me 6 bananas and 6 cauliflower, how will I feel it? So sometimes if you go on the CTRI, the comebacks always there when there is a lacuna. So there is a tutorial on the CTRI. Just click it. And if you start filling up with each, if you put a click there, it will open what to fill. If you don't fill it correctly, it will come back. If you fill it correctly, I'm telling you, 95 to 98% of CTI approval comes at the first go, and they have never questioned me for revising that this is not limited.
No,
So,
even we are getting the approval. There is no doubt about that. But sometimes we are finding it little difficult.
So you can let me know, anybody who finds that because I know those people well, they are near to AIMS only. Somebody feels that they are not getting CTRI unexplained. They are not able to understand. They can let me know. And I can assure you, they don't take more than 2 to 4 weeks for your approval. Once you have correctly paid. If you incorrectly, it goes into a backlog. Then it will take a long.
And there is one question in the chat box that person wants to know. Just a minute. Can you explain a little bit about hypothesis, how to frame it, whether it should be null hypothesis or alternative hypothesis?
Right. Dr. Ayappa has asked it, and there's another question from Lakshman Kumar Senipati also. They asked why we don't have the option online ad of print in ICA. So Dr. Senapati, the answer is small because there is no pending articles in ICA during my tenure. I've just finished my tenure last November. So there was no pending articles actually. So when there are no pending articles, it's not worth to have ahead of print. So if you see the graph of the Indian Journal of Anesthesia, all the articles will publish in 3 to 4 months for last couple of years. So ICA was very time frame, and there were no pending articles. That's why there was no requirement of ahead of print. Ahead of print is usually considered when there is a lag period of acceptance to publication more than 6 months. So in ICA, the articles were published in 3 to 5 months. So that's why there was no ahead of print. Dr. Ayappa's question about hypothesis and how to frame it. Now, I said when you plan a research, first is your research question. And research question, I mentioned it is based on the PICOT. Population, intervention, control, outcome, and timings. Now, this research question will make your primary objective itself. Now, when we say hypothesis, because you have done the review of literature, you have to presume something because you have done it, because your study is based on some presumptions. I will just explain you why you need hypothesis. So you have to say, we hypothesize that drug A will have longer duration of analgesia as compared to drug B when given for this ultrasound-guided facial pain blocks in adult patients undergoing this surgery. So you have to hypothesize. Now, when we say hypothesize, this is the hypothesis based on the research question. Now, this is your introduction section. But when you want to do a statistical analysis, now statistical analysis, when you use SPSS or R, there are certain presumptions. So you put a null hypothesis. When we say statistical analysis, the algorithm or the analysis of the stats is such that you have to presume that there is no difference exists. We said hypothesis that drug A is better than drug B. But when we want to apply the statistical tool, we have to assume that there is no difference exists between drug A and drug B. So this becomes your null hypothesis. When you do a statistical analysis, you have to reject this. So when you reject, this itself becomes that drug A is better than drug B. So these are little technical terminologies, which are presumptions, which require statistical analysis tools. And since we have to assume those assumptions for static analysis, this term of hypothesis, null hypothesis, and sometimes alternate hypothesis comes into picture when you are looking for two directions and you don't know which way it is look up. So that's why you have to answer it. And that's more of a statistical understanding.
So thank you very much once again. I think there are no question on the chat box now. So on behalf of ICA, again, I thank Dr. Rakesh Garg for an excellent presentation and clearing all our doubts. So Shreyashi, can we conclude? Vineet, can we conclude the meeting?
Yes, ma'am. Yes, ma'am, please. Tracy, are we audible?
Yes, ma'am.
Yes.
Yes, sir. So thank you so much everyone for giving us the opportunity to host the session. So with this, we are concluding the session over here for today. Good night, ma'am. Good night, sir.
Good night. Good
Good
night.
night.
Now, can you tell
Thank
me
you,
how
sir.
much was the attendance?
Yes, ma'am. Let me check once again. Currently, ma'am, 32.
32. Okay,
Yeah.
fine. Thank you.
Thank you. Thank you, ma'am.
Thank you. Thank you.